Good evening, everybody. Welcome to my YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And this week, we're going to go into nutrition and talk about various types of diet. Is there an ideal cardio diet? Well, those of you that know me probably know that I'm not a one-size-fits-all kind of person. And why? Because there's just too many variables, okay? Like one is genetics, for example. And now this is a really burgeoning field, this whole thing about genomics and nutrition. Some people can tolerate fat quite well, others can't. Some people have what's called leptin resistance, which could be genetically determined, and they just don't feel full, so they just keep eating. Also, other variables include age. How about personal goals? Is it for performance? Are we talking anti-aging? We talk about weight loss. So it really depends on your goals. And also food allergies and sensitivities. About 8% of people that have a true food allergy, such as hives, itching, or respiratory symptoms, asthma, etc. But about 50% or more, 56% have actually food sensitivities. And that's a little more difficult to decipher because that can happen hours after you've ingested a particular substance or even days later. Also, the lipid profile. We've talked about lipids a lot as a cardiologist. It's important. Cholesterol, triglycerides. Is there a metabolic issue? Does someone have diabetes, prediabetes, metabolic syndrome, polycystic ovarian syndrome, low non-alcoholic fatty liver disease? So all these variables really play a role into what kind of diet you may wish to choose. Also, let's talk about gut function, irritable bowel, leaky gut, inflammatory bowel disease, Crohn's disease, ulcerative colitis. So there's so many variables. I don't think there's really an ideal diet. So anyone that tells you that their diet is the go-to diet or the end-all be-all diet, walk the other direction, because it just doesn't exist for the reasons I explained. There's just too many variables. That said, let's talk about the ideal cardio diet. Is there an ideal cardio diet? And when I was putting this talk together, this presentation together, I realized that it's really too much in segments. So we're going to divide it up. So tonight we're going to focus on the Mediterranean diet and also the paleo diet. And then next time, which will be in 2 weeks, we'll talk about vegan diet and also ketogenic. And we'll go from there. So I first want to just talk a little bit about how healthy diets are defined on the internet. Okay, I did a little research on this. I'm going to read you what I found. Now, the Mayo Clinic in 2021 said that fruits and vegetables are the main things, and it can be fresh fruits and vegetables or frozen. And they could also, what is allowed is low sodium canned vegetables. I don't know about you, but I don't eat anything out of a can. Canned fruit packed in juice or water. And they frown upon coconut. They don't like coconut because it's saturated fat. Now, how about the American Heart Association? In 2017, their thing was eat an overall healthy diet that emphasizes a variety of fruits and vegetables. I think we all agree that fruits and vegetables are good. Whole grains and low-fat dairy products. We talked about grains 2 weeks ago when we talked about those nutritional myths. I mean, truly, all grains are processed. Let's face it. I mean, I don't know what a whole grain is. All grains are basically processed carbs. And there's really no nutritional value in them, but they do add texture and variety to our diet. But why they still tout grains as healthy is beyond my understanding. Low-fat dairy products. We talked about low fat. Is there any reason to have low fat? I don't think so. Skinless poultry and fish, nuts and legumes, and I like this one, non-tropical vegetable oils. We're talking sunflower oil, Mazola corn oil, safflower, sesame oil. These oils are processed, and they also are pro-inflammatory. So why would any person interested in a healthy cardiac diet, want to have anything that is even remotely pro-inflammatory? And here's a good one. They want to limit saturated fat and trans fats. Now, of course, we all agree that trans fat is horrible for you. These are basically processed fats or fats that have been altered, like stick margarine or peanut or Skippy peanut butter. They've all been altered so that they're solid at room temperature. So I think we all agree that trans fats are not healthy. But then when it comes to saturated fat, if you have a cholesterol problem, they recommend that you have no more than 5 to 6% of your total calories coming from saturated fat. That's really not a lot. And as I mentioned 2 weeks ago, saturated fat hypothesis really originated in the 50s, actually in the 60s and the 70s. And it's because we know that saturated fat can increase the LDL or lousy cholesterol. But as I said before, and as I'll say once more, saturated fat has never, ever been shown, conclusively been shown to cause heart disease, strokes, or death from any cause. Still, these associations still frown upon it. Cleveland Heart, decreased saturated fat and trans fats. The American Heart Association with the American College of Cardiology, which is my specialty organization, came out with the lifestyle management guidelines in 2013, urged people to eat a healthy diet and decrease saturated fats and trans fats. And what do they recommend? Polyunsaturated monounsaturated fats such as olive oil, and also polyunsaturated fats. I know we've talked about polyunsaturated fats. It's omega-6s. We don't need any omega-6s in our diet because they're pretty plentiful in anything that's processed. They also recommend canola oil. And I urge you to watch the video. It's about 3 or 4 minutes on how canola oil is actually processed. It's very industrial. Because it's unsaturated, because it's monounsaturated, it's touted as a healthy heart oil, but it is very processed, and I don't recommend it. And they also recommend soy, which is very controversial, in fatty fish. Now, I like this one. They said we should now be eating 7 to 9 fruits and vegetables a day. Now, when I was studying nutrition in the 90s, and I really began my interest here, it was like 3 to 5. Now, all of a sudden, it's 7 to 9. Now, I don't know about you, but how many people can eat 7 to 9 servings of vegetables and fruits a day unless they're total vegans? I don't think it's really practical. And why is this so? Because the soil that it's so depleted of minerals and valuable nutrients from over farming. It's just pathetic. So that's what your big organizations, Mayo Clinic, American Heart Association, American College of Cardiology, they recommend in their heart healthy diet. And it's all pretty much the same thing. So let's look at the Mediterranean diet. Now, this is probably the most studied diet of all, and with good reason. I mean, it's unprocessed to a certain extent. And we knew from the 50s and 60s that people living in like Italy, Greece, these people tend to have less heart disease than we do. And what they find was their diet. So it's basically hefty amounts of olive oil, red wine, fruits and vegetables, of course, and they recommend to breads and cereals, which of course process, extra virgin olive oil I mentioned, fish, poultry, dairy, and eggs with a very limited amount of meat. So that's the standard or classic Mediterranean diet. So the Predimed study, Predimed study, came out, and the article was published in 2013, and that really shed light on this particular diet, because we want to look at the long-term effects. And this is a study that came out of Spain. They studied like 7,450 people. So it was a large study, and it was a primary prevention trial. So they took people with known risk for heart disease, meaning based on their risk factors, but without confirmed disease. They haven't had events. They haven't had heart attacks or strokes or stents. And they divided them up into 3 groups. Group 1 had the Mediterranean diet that we've mentioned with olive oil. Group 2 had Mediterranean diet and nuts. And Group 3 basically had your typical low-fat diet. And what they found was that in groups 1 and 2, there was basically almost a 30% decrease in the risk of developing either heart attacks, strokes, or death from heart disease. This is really a landmark trial. And a lot of studies have come from that. And we also learned that there may be also less breast cancer, less diabetes, people that adhere to this type of diet. So in review, or in retrospect, the Mediterranean diet is a sensible diet and may actually help prevent heart disease and premature death. So now let's move into the paleo diet. The paleo diet is one of the more popular diets today, and it's the diet of our hunter-gatherer ancestors. And the premise is that our ancestors didn't have the chronic diseases that we're dealing with today. And of course, they didn't really live as long as we do today because it was a different time. They didn't have antibiotics, and remember, you were chased and eaten by a saber-toothed tiger. But, what was the average lifespan? 35 back in those days. So I don't think you're really comparing apples to oranges, but be that as it may, the premise is that they had less of the chronic diseases that we see today. And the good thing about the paleo diet is nothing is processed. There are no breads, there are no cereals, and there's different. Some are very, very strict; don't even allow legumes. So there are different forms of the paleo diet, but the basic thing is that it's not processed. Now, it's very interesting, but most of the studies that I have reviewed on paleo diet are relatively small in number, and they're generally of short duration. And also, there's oftentimes not a control group like there was in the Prediabetes study. But what we do know from the small amount of studies that we have is that there's a decrease in total cholesterol and in LDL, or lousy cholesterol. There's a decrease in triglycerides. There's an improvement in glycemic control, meaning improvement in blood sugar control, and also a decrease in blood pressure. So these are all the various risk factors that we see with heart disease. So what's my take on all this? My take is that I'm between Mediterranean and paleo myself. I like the fact that the paleo is non-processed. I really try to limit my carbs as much as possible, but I'm not straight paleo, so I'm somewhat in between. But they both are certainly a lot better than the what we call SAD, which is a standard American diet. So that's my take. And next time we'll talk about the vegan diet, vegetarian diet, and also ketogenic. So at this point, I'm going to stop and ask you guys for questions that I can hopefully answer, because it's a great topic. So please, let me hear your questions. Hmm. Okay. Thank you. Let me just get my glasses on. Senior moment here. Thank you, Dr. 𝗪𝗓𝗪. Agrees with paleo Mediterranean. I think that's a good point. It's, what do I like the most? I think it's between those two. And again, there's a role for all diets. When we talk about metabolic issues, we'll see that there may be a role for ketogenic. And I really believe in patient smarts. So whatever diet works for you is a diet that you should stick with, especially if it's healthy. So I don't really have a set plan. Sometimes I'll recommend one diet over the other, depending on the patient's, like I said, their metabolic profile, their lipid values, whether they have heart disease or cancer. So I really try to individualize any of the recommendations that I make. Okay, which diet is more sustainable long-term in your experience? I think the Mediterranean diet is probably the most sustainable. And I can't remember how the Prediabetes study was. Gosh, I can't remember. I know it's about 54% women and less than the other percent with men. I think it was, I don't know if it was two, it was a long study. I think they both can be. You make it, again, a true paleo. They don't allow legumes. And I think dairy is pretty much out because, it is processed. So it tends to be a little bit more boring. But I think they're both sustainable. Certainly when you compare that to some of the other diets out there. And I think that's really important point is sustainability, because, when I think of diet, you take off the T and you have the word die. And that's why I've never been a proponent of real diets, because they tend to be very unforgiving, and most people that do diet, they lose weight and they gain it all back plus more. So we're talking about lifestyle here, we're talking about health, we're talking about what's good for the heart, what's good for the immune system. So sustainability is really important, but I think you cannot go wrong with either of these two diets. Let's see, anybody else? Hmm. Well, let me just segue into this whole thing about oils. What is the optimal oil? And I think most of us agree that olive oil is a great choice because it's monounsaturated, it's high in polyphenols, and it's overall healthy. And people think you can't cook or saute with olive oil. That's not necessarily true. It's got the reputation of going rancid, and I think unless you use very high temperatures, that doesn't really happen in reality. And I've talked to many people that really specialize in olive oil. So to me, it's still the healthiest oil, the one that certainly I use the most in cooking and generally. How do they compare to the vegan diet? Okay, the vegan diet we're going to talk about next time. Again, it's a matter of choice. It's a matter of what your options, what your goals are. Some people really like the vegan diet. I find the vegan diet a little limiting. And also, if you're going to go straight vegan, or let's say straight carnivore, which we haven't talked about, which we'll talk a little bit about next time, these are limited diets, and people that like carnivore, which I think is fine for the short term, there's an issue, and that is you really need to do some micronutrient testing, because after a few weeks of being on any type of diet that's totally restrictive or very restrictive, you're going to probably find there's some micronutrient deficiencies, which can affect our overall health. So what I recommend at that point is to do micronutrient testing if you do that. But I don't think there's any one perfect diet. A vegan diet, some people love it, and that's fine. Does the brand of olive matter? Yeah, yes, it does. Okay. First of all, you want to make sure that you can go to the internet and find out what olive oils are actually the best ones to get. I'm very leery about olive oils coming from Italy, because now if you're in Italy itself, you're going to find really healthy olive oils. But the ones that are exported to the United States, a lot of them have been tainted, and there's a mixture of oils in it. It's like a mixture, tainted, and you might find canola oil and other oils in it. So I'm very leery about that. I like Spanish olive oil. I think California olive oil is relatively healthy. So it does matter. You want to make sure you got pure extra virgin olive oil and nothing that's been tainted. So, but if you go, you can easily research and Google what are the healthiest olive oils. And I think one that actually they did quite well, believe it or not, is the Kirkland brand from Costco. You wouldn't think so, but actually it's been highly rated. So just check, and it may change from time to time, but a lot of the Italian ones are not like you think. Okay, that was a brand. Okay, what else? Still waiting for questions. Let's see. Good. Okay. Oh, I got a couple more. All right. Let's see what we have here. Is there a diet to raise one's blood pressure? Well, that's an interesting one. That's not a question I get usually asked. To raise one's blood pressure, first of all, the question is, why do we want to raise your blood pressure? But I understand if you have like a dysautonomia or a problem with, it's funny, dysautonomia is like an alteration in your autonomic nervous system. So what happens when these people stand, or when they sit up or stand, they'll drop their blood pressure because it's autonomic nervous system dysfunction. It's not something that you can will. You know, like I can decide to pick my glasses up, right, and put them back down, but I can't actually will what happens to my blood pressure when I stand if my autonomic nervous system has been disrupted. Usually it's by medication. Also, nerve diseases like Parkinson's can lead to it, and something called POTS syndrome as well, postural orthostatic hypotension. These people, when they stand, they get very dizzy and can pass out. So yeah, you have to liberalize your salt. That's the most important thing. And everybody's been told how bad salt is, right? Well, that's not necessarily true. So liberalizing your salt would be very important. There are medications you can take. When it's 5-hydroxycortisone, which is easily also known as Florinef. But really, it's liberalizing your salt. And during and it's so, actually it's very liberal in that respect because it's so different, right? We're told to have a low salt diet. I think that's really changed. I rarely talk about a low salt diet unless I'm talking about people that are actually salt retainers, and most people are not, so that's a good question. And with dysautonomias, I don't think we've been really successful with food and diet. The other thing, of course, with low blood pressure is liberalize your salt and hydration. These people have to drink a lot of fluid. If they get dehydrated, it'll further drop their blood pressure. Those are the two main ones. There's no other real miracle drug, unfortunately, miracle for that. Okay, does a paleo Mediterranean better or preventing heart disease or diabetes? Well, we know that the Mediterranean diet has been studied extensively. That's the Prediabetes study that I quoted from 2013. It's unequivocal as far as that's concerned. I think the paleo diet is probably as successful. It's just that we don't have the numbers. I mean, you can't compare 7,500 people to small groups of people of less than 100, and oftentimes without a control group. We had a control group with the Mediterranean diet. So, and even they both can be helpful in diabetes. We'll get more into that next time we talk about the ketogenic diet. But they both have been shown to improve glycemic control, even the small amount of people that we've studied with the paleo. So again, these two diets kind of go hand in hand. It's just how strict do you want to be? Do you want nothing processed at all? Go paleo. If you want to be a little more liberal, then you can go Mediterranean. So what I try to do is, when I'm home, is really limit any of the processed stuff. Like I don't eat any cereals at all, which is allowed in the Mediterranean diet. There's no such thing as a healthy cereal, and even oatmeal is okay, but it's still a carb. So I just don't eat breakfast anymore, except for eggs. Okay, but they both, I think, have that very important. What diet has been with help with reversing? Okay, let me put my glass on this one. Oh, great question. What diet has helped reverse calcium scan? Okay. So people that know me know that I do a lot of coronary artery calcium scanning. This is a rapid CT scan that tells us how much calcium is in the coronary arteries. So usually you want to have the ideal number is 0. You don't want any calcium in your coronary arteries, but as we get older, that becomes less likely. So you get a score, and if you go to a facility that's a lot like Harbor UCLA, which is what I tend to use a lot, they'll give you a score. Let's say 0 is perfect, 100, 1,000. I've had 2,000 or higher. So the higher the score, the more coronary disease you have. But we're looking specifically at calcium. It only tells us about calcified plaque. It does not tell us about soft plaque, which is a problem. Because if you get a 0 score, which I happen to have had, and then I had a small heart attack about a year and a half later, it's like a false sense of assurance. So now, what's going to reverse that? We can definitely reverse soft plaque. Those of us in the preventative field feel pretty comfortable about reversing soft plaque. Once it's been calcified, it's pretty hard to make a change there. So when I tell my patients, and I do more than one type of test, now I'm doing something called the pulse test, PULS, which looks at how your body reacts to soft tissue, soft plaque, meaning how is it laying down plaque? What's acute and what's chronic? We want chronic healing, which is what calcium is. Calcified plaque can also be somewhat protective, because it's unlikely that calcified plaque is going to break off and cause a heart attack or stroke. It's a soft plaque that we concern ourselves with, and really about 45 to 50. Most heart attacks actually take place with lesions that are 40 to 50% blocked, not 100% jobs. That because what happens, these vulnerable plaques that are unstable, they rupture and they give rise to a blood clot, and that's what leads to the actual heart attack. When I was a fellow many years ago, we learned that blockages get from 60% to 70 to 80 to 90, and then you just die, had a heart attack. It's not that at all. It's not about the severity of the blockage. It's about, is it vulnerable or not vulnerable? And unfortunately, there's not easy test that does that. So the calcified scan just shows us calcified plaque. So I wouldn't worry so much about lowering the calcium score. What I concern myself more with keeping the score at where it's at. other words, like you expect like a 10% change from scan to scan. And usually I'll do my scans every 2 years of my patients. If it's 10%, okay, that's not bad at all. And if it's like, let's say 40% or 30%, that's significant. That means we really have to hone in on risk factors, which would include diet and supplements and oftentimes medication. We definitely have to use medications in patients that have malignant coronary disease. I have a patient today that had 3 stents placed in December. He's a very high risk patient, so I sent him to Scripps Clinic in La Jolla. And lo and behold, he started having angina again. I sent him back there, and he had the right coronary artery was completely reblocked, and the 2 other arteries already have blockages in them. They're talking 3 months. That's what you call malignant coronary disease. Now, this person isn't the healthiest. So, but coronary calcium is not so much the bad sign. It's a vulnerable plaque we worry about. Okay. How do you distinguish between needed calcium to prevent? Okay. All right. So years ago, you people probably knew that what we did, we gave calcium to prevent osteoporosis. And I think we gave like 1,500 milligrams to most women. And the problem with that is that we didn't realize what we were really doing. So a lot of the calcium was going to the arteries and to heart valves. Not a good thing, right? So now I have my own formula called BoneWise. So now we know that we have to use calcium, but we don't need as much. We don't need 1,500. I think in my formula, like 750. But you have to make sure you have magnesium, vitamin D3, also vitamin K2, which helps to shunt calcium from the gut to the bones and to the teeth. So you want calcium to go where you want to direct its where it travels, and that's where these things come in handy. So it's not just calcium; it's lower amounts of calcium added with magnesium, boron, strontium, and vitamin D3 and K2. I'm probably leaving out a couple things. So that's how we do it. We give less calcium than we used to, and we don't use calcium by itself. That was what we did. That was wrong, incorrect 15 or 20 years ago, when every woman was told to take large amounts of calcium for menopausal osteoporosis. So thank goodness that's changed. Okay. Any other questions before we close? Okay. Well, listen. Next time, which will be in 2 weeks, we'll be talking about the ketogenic diet and the vegetarian or really vegan diet. And we'll talk about the pros and cons of that. And any other questions you have, please put them in the comment section, because we do like to see what you're interested in. And we'll be glad to address that. So please, any topics you would like addressed in the comment section. And we will see you in 2 weeks. Okay. Thank you very much. And have a good night, everybody. Thank you very much.